Case presentation Pleural Effusion. Case scenario Brittany Brooklyn, 23 years old female, presented with symptoms of cough and shortness of breath on exertion from the last few weeks. She is also having right chest pain from last week. Pain is aggravated by deep breathing and coughing. It is associated with fever and night sweats. History. Chief complaints: cough, fever, dyspnea, right side chest pain. History of present illness. Brittany was all right 1 month ago when she noticed shortness of breath while performing strenuous physical activity. At start, she ignored it, but later it progressed while going upstairs or walking fast. For the past 3 weeks, she is also having episodes of cough. It is accompanied with sputum that is white and frothy. But 10 days ago she had one episode of blood-stained sputum. She also felt pain in right side of the chest from last 1 week. Pain is sharp that causes her discomfort and is intensified by deep breathing and coughing. Past history. No history of hypertension, no history of diabetes mellitus, no history of heart disease, no history of previous surgery, no history of any chronic disease. Personal and social history. Brittany is a student and lives in hostel. She is living a normal healthy life with good support from her parents. She has no smoking, alcohol or drug history. From few days she is having disturbed sleep due to her symptoms. Family history. Her parents are alive and healthy. She has no family history of diabetes mellitus or any other heart disease. Her father was diagnosed with tuberculosis 10 years ago. Allergic history. She has no history of allergy. Treatment history. She took painkillers, that is paracetamol and cough syrup, before coming to hospital. Examination. General examination. She is conscious, alert and well oriented. She looks pale. There is no cyanosis, clubbing or koilonychia. There is no edema or palmar erythema. JVP is not raised. Pulse 110 beats per minute. Blood pressure 130 by 180. Temperature 102 degree Fahrenheit. Respiratory rate 28 per minute. Examination. The examination of respiratory system shows inspection: bulging of chest wall, abdominal thoracic type respiration, reduced movement of chest, palpation, trachea shift to the left side, symmetrical expansion, tenderness at right side chest, decreased vocal fragments. Percussion. Stony dull note, mild dullness over the right chest, auscultation, diminished breath sounds, no additional sounds, decreased vocal resonance. Investigations. X-ray. Trachea shifts to the left and right side, pleural effusion. Pleural biopsy, presence of Mycobacterium tuberculosis. Diagnosis: tuberculosis, pleural effusion. Treatment plan: surgical treatment, pleural aspiration or thoracentesis. Medical intervention: antibiotics, tab, azithromycin 650 mg, anti-TB drugs, and these include isoniazid, rifampicin, ethambutol, pyrazinamide. Cough syrup, Tritex TB syrup 100 ml. And then here comes physical therapy management, which includes chest physiotherapy, percussion, vibration, deep breathing exercises, diaphragmatic breathing exercises, huffing and coughing techniques. And what are the goals? These include short-term as well as long-term goals. Short-term goals. Short-term goal is to relieve the dyspnea and cough. It will also relieve permanently when underlying cause is treated. To reduce chest pain, strenuous activity should be avoided because activity triggers the pain and causes discomfort. Long-term goals: Long-term goal is the treatment of the underlying cause. Management of pleural effusion is by draining the fluid from the pleural space to provide symptomatic relief. Underlying cause, which is tuberculosis, is treated with anti-TB drugs. Prognosis depends on the severity of the underlying cause and its effective treatment. The complete resorption of pleural fluid is approximately 6 weeks, but it can be as long as 12 weeks. Recommended treatment for tuberculosis is 6 months. Home plan and patient education. Follow strict compliance to treatment regimen given to improve the current condition, especially medications, diet, and lifestyle. Avoid physical activities that may intensify pain and cause difficulty in breathing. Continue the exercises at home. Take medicines on time. Get plenty of rest. To decrease your pain when coughing, hold a pillow over the chest where pain occurs. Have adequate sleeping hours, that is 6 to 8 hours. Take proper and healthy diet. Drink enough fluids. Patient feedback. I was very much worried about my condition because it happened to me for the first time. Normal fever and cough were normal before, but when I experienced difficulty in breathing and chest pain while performing any strenuous activity, I got worried. So I thought I should consult a doctor. Now I am diagnosed with TB. It is difficult to manage it with because I live in the hostel. I will strictly follow my treatment because I want to recover as early as possible. It was a good experience being treated thoroughly by you. And here are the references. Thank you.